So my name is Dr. Robert King. I'm the Vice President of Aesthetic Management Partners. And my background is extensively, obviously, from the medical side as a physician, training in surgery, but really my background in the science side is in cell biology, background in physiology and biochemistry, and so essentially I like to say I'm a cell nerd.
A cell nerd,
Yeah.
I love that. Well, you know, I'm a skin geek, so
that.
I think this is the perfect combination for us to kickstart this wonderful conversation all about this amazing product that you brought to the UK called EXOIE. Welcome.
Thank you. Happy to be here.
So, Dr. Rob, we're going to be taking a deep dive into your entire portfolio that I've had the honor of having in my clinic for 2 years now. So we are hitting our 2nd year anniversary of EXOIE here in the UK. Congratulations to you and your team.
Thank you, and congratulations with your success on it as well. And I know from our conversations and even visiting your clinic, you have a lot of happy patients. So
Yes.
we're happy to hear that.
Fantastic. Well, look, you know, I'm a big believer if the product works because it is safe, it has great efficiency, and it has scientifically backed evidence behind it.
Sure.
You know, all of those things are something that me as a clinician would look for when choosing anything, whether it's a topical, a device, a technology, and facial injectables into my practice. So I think it's great that we're able to have this conversation where everyone has access to your extreme amount of knowledge in everything science of aging, which I think is critical in understanding all things EXOIE.
Well, I'm happy to have the conversation, and I'm excited to actually be able to share all the technology behind the products and really answer the questions and go on the deep dive with you. For sure.
Wonderful. Dr. Rob, it's been wonderful to have you here talking all things EXOIE with us. Can you share with us what EXOIE is and how you've brought it into the UK?
So EXOIE is a revitalizing complex in itself, and it's not one single thing. It's actually a series of treatments together is what makes up the complex. You know, nothing we do in medicine and aesthetics is a one-hit wonder. You know,
Yes.
we don't do a laser treatment once, we don't do RF microneedling once, we don't do neurotoxin once, we don't do skin boosters once. So we have to continually stimulate the system, and that's literally what the basis of EXOIE is built around. Ideally, you have a pre-treatment portion, a day of portion, and then a recovery portion as well. So first and foremost, we pre-treat with the detox.
Yes.
And ideally, what you're going to do is for twice daily for 7 days is going to pre-treat, and that's going to stimulate autophagy in the skin and also help with a lot of hydration as well, because we know clean, hydrated skin is going to receive a treatment much better than dried out, non-clean skin, right? So the energy is going to be received in, because most of the time our target on most of our energy-based devices is water. Correct. And so if we have very hydrated skin, you're going to receive more energy, then you're going to have a better response from the skin as well. So then day of procedure, we move to the EXOIE. So ideally what you're going to do is you're going to pre-treat with this prior to numbing, and what you're doing is then pre-treating the skin for inflammation with anti-inflammation factors.
Correct.
And it's a booster because you're getting a treatment within a treatment. You're going to massively stimulate hyaluronic acid production, collagen production, and elastin production. And so obviously that's what we're trying to do when we create controlled wounds. We're injuring the skin, right? It does create some inflammation. So the goal of EXOIE is to shorten that inflammatory period from 6 days down to a few days, right? So we get to the proliferative phase much faster. So we change that wound healing curve, and then you're getting that treatment within a treatment by hyper-stimulating collagen, elastin, and hyaluronic acid production by not adding any synthetics in, but allowing the body to do what it naturally does and giving it thousands of growth factors so all the building blocks are in place. And then lastly, repair. So repair's idea is that you're going to continue the signaling of EXOIE. So you're going to continue that anti-inflammation and continue that stimulation of collagen, elastin, hyaluronic acid production. And so you continue down that wound healing path much faster with reduced inflammation and stimulated building blocks of the skin as well.
What I really want to do now is just elaborate on this 15-day system, because this is essentially what I brought into my practice, because I carry out a lot of microneedling radiofrequency, I carry out a lot of fractionated laser treatments, I carry a lot of injectable treatments as well. But essentially what we're trying to do is to reduce the pain, the inflammation, the downtime, bruising, swelling, erythema, all of those things, that come with our in-clinic treatment. So I brought this in as an in-clinic procedure.
Absolutely.
Correct? And what we're trying to do is, as you say, prepare the skin. So with pre-treating the skin for 7 days with detox, we are creating this new system called autophagy. Now, it's nothing new because autophagy has been known for years, but I think I would just love you to explain what autophagy means to the UK public and beyond, because I just found that step really interesting.
Absolutely. So autophagy is going to be essentially stimulating the immune system within the skin, so the macrophages that come and eat toxins up in your skin and then we'll push them out. So it wouldn't be uncommon to actually see a purge from the skin after a couple of days, which is a good thing. That is expected, and that way you know the skin is doing its job. So it'll come and stimulate those cells, and then they will eat up whatever toxins, exposure, makeup, some things, whatever we're putting on our skin, different moisturizers, they all carry something within them that really isn't supposed to be in our skin. So your skin's going to push that out, right? And then you'll see the purge a lot of times, and you're also going to be hydrating as well, extensively hydrating the skin.
Super important.
Very important.
Yes.
And so that way we have really well hydrated and clean skin from the inside out is really the goal of what detox is doing.
So Dr. Rob, I'm just so fascinated even by the first step. We do a lot of skin preparation before our treatments, and I think many patients still don't understand why we need to do this. There's makeup, there's debris, there's pollution particles that just settle in the pores, and you've also got toxins from the inside if we've been tired, we've had sleepless nights, and maybe indulgence, and also just other things. Maybe we've just been not looking after our skin for decades. And I spent a lot of time on skin preparation, so I'm fascinated by being a skin geek as well. What is in this? We talked about exosomes, but what really are the plants that are within detox that helps this purge or this clearance? You said the word autophagy, and I'm fascinated about that. Can you explain?
Absolutely. And I love that you say exosomes and then there's more. And there is. Yes. It's so much more than exosomes. It's really the growth factors that are part of going inside of those exosomes. And one of the key ingredients is the shikakai. So it's actually a soap nut. So we utilize stem cells from the soap nut plant, and those are known from Ayurvedic medicine principles to stimulate autophagy within our skin. And there's another fungi ferment as well that is actually a big part of the hydration that detox provides as well. It's a lipophilic serum. Nice. And that way it really hydrates the skin without leaving any kind of coating. It's not sitting on top on the epidermis. It goes right through and it's into the dermis and really absorbs through the entire dermal architecture. So ideally, you could use detox in the morning, if you're a female, and then put makeup on right over the top of it, and you don't have to worry about washing it off.
This is really critical because most of my patients are on 2 or 3 glasses of water a day. It's just not enough. We should be on at least 2 to 2.5 liters of water a day. So many patients come in inherently dry. And if we're dry, we're dehydrated, we're compromised. Cell-to-cell communication just does not happen effectively. So if patients come in expecting an end goal from microneedling, radiofrequency, fractionated lasers, but they're dry, dehydrated, compromised, then this is the ideal preparation to get them ready for the procedure.
So ideally what we're trying to do is mimic the body's own natural signaling and our own cycles. So when we wake up in the morning, what are we? We're dehydrated, right? Sure. We've breathed all night, we have lost a lot through evaporation in our breath, so we're supposed to wake up and drink water, as you talk about. Yes. Well, your skin needs to wake up and drink as well. And so the first thing in the morning, your body is gonna feel dehydrated. Your skin can feel very dehydrated. So ideally you'll wake up and you'll get that hydration when you apply the detox in the morning, and then you're also stimulating autophagy, which is going to help you when you get exposed to toxins all throughout the day.
This is a very unique system. It's very different to some of the others out there. And this is what I get asked a lot. Why have I chosen this system? Right. And really it's about the science behind what EXOIE is. E stands for equilibrium.
Correct. Yeah. So in naming it, we really wanted to have purpose for people to understand that it is an entire complex. And the E is equilibrium in that it is designed to balance the body's skin. We're not trying to override, we're not trying to provide any kind of, and there's no synthetic signaling in this. What we're literally doing is mimicking the body's wound healing process. There's literally 20 years and $20 million of research into that syringe right there.
This one.
Yeah.
Great.
So, and what we've done is really, the way this works is we learn the language of the cells. And so ideally we first looked at human stem cells, and we put them kind of through a wound healing process. We put them through inflammation, and we saw what they released, and you would put them in a proliferative phase, and you would see what they release, right? And then you put them in the remodeling phase, and you see all the factors they release. And it's thousands of factors in this language. You know, it's releasing, you know, the stem cells are releasing microRNAs, they're releasing, you know, peptides, polypeptides, you know, a bunch of different proteins, a bunch of different growth factors, you know, all for the biochemistry of what's going on in each phase.
Yes.
And how we did that is we took the stem cells, we put them in our patented medium, and we could control their environment so we could get that read and really that kind of language printout, really the script of what's happening.
I get that.
And then we utilized that same medium with human and plant stem cells together to see if we could get them to talk to one another. So can plant stem cells interact with human stem cells? Sure enough, they did, and they would produce those factors together. So then we knew we really had something, because the cells can communicate across cross-kingdom for sure. And that's been in the literature for years, but getting to do it is the tricky part, right? So then finally for the product, what we did is we took, you know, a blend of different plant stem cells to get the exact language that the stem cells produce. So we learn the language of the stem cells, and that's really what EXOIE is. So you're utilizing it, you know, prior to numbing of the day of a procedure, or even a standalone as a facial. So you can get, you know, plant-based stem cell technology facials done as well. And ideally you want to pre-treat with it, because then you're setting it to actually affect inflammation at a cellular level. And we're not blocking it. You don't want to block inflammation, right? Because everything we're doing is a controlled wound, right? We want the downstream effects, because that produces collagen, elastin, hyaluronic acid in the wound healing process. And you know, if you block it the way, say, a steroid would, that's going to impede healing. It's going to impede wound healing. What this is doing is actually reducing at a cellular level the amount of inflammatory, pro-inflammatory factors the cells will produce. And what that does is that shortens that inflammatory curve. You know, whether it's, you know, if it's 3 days, it's going to chop it down to, you know, to minimize that. If it's 6 days, it's going to really chop it down to a couple of days. So you're going to minimize that huge histamine response. You're going to minimize this swelling that you see, which allows us to get through inflammation and then the proliferative phase to kick off much faster. So you're going to see recovery faster. But then in that proliferative phase, it's carrying signaling in the building blocks to stimulate naturally type 1 and 3 collagen production, and then production of elastin massively, and then production of hyaluronic acid as well. And there's no synthetic hyaluronic acid in the product. We get asked this a lot. And they're like, well, why didn't you put hyaluronic acid in the product? Well, if we stick synthetic peptides or synthetic product in there, we actually start to shut down our natural production. The body won't produce something that you give it if it doesn't need it anymore. That's negative feedback, right? So we've seen that in hormonal control. We see that all throughout the body. So, you know, and studies have shown, you know, if you utilize synthetic hyaluronic acid in your skin, and every cell in your body makes hyaluronic acid, you'll actually decrease your natural production.
In the long term?
In the long term. Yes. So what we want to do is give the cells the signaling in the building block to make their own hyaluronic acid, and to make their own collagen and elastin. And that's how EXOIE is formulated.
Amazing. So all of these things that we've been probably doing for decades as men and women, by applying moisturizers, by applying topicals on our skin to supplement HA production, we could be actually doing long-term detriment.
In some cases, yes. And the data really does show that, you know, if you're giving it the end product instead of stimulating it to make the end product, you'll actually decrease the production of the end product.
It is so transdermal. I remember using this myself 2 years ago, and it felt like it was just going straight through.
Absolutely.
Patients loved it, and it's that whole lipophilic nature of the product.
Being transdermal, or just being able to penetrate through the epidermis, is really what that means. The way that this is done is, it's because the exosomes themselves are really the membranes surrounding them. They're just little membrane-bound vesicles that the stem cells release. And what they do is they pinch off a portion of their own cellular membrane, and so they're a vehicle, right, is how I describe them, or an envelope even. You know, and we can put a letter inside of the envelope. We can put whatever message we need into there and then load it inside the envelope and then send it off in the mail to where it needs to go. Ideally, these envelopes are carrying signaling processes for anti-inflammation and signaling processes for stimulation of collagen, elastin, hyaluronic acid. So those lipid bilayers, or the membranes around the exosome, literally touch the membranes of our cells and get absorbed right in. So
I feel it.
There's no sitting on top in the epidermis. There's no crusty layer. Even some of our products that almost like a fatty content to them, they still sit right on top and feels greasy.
Correct.
You don't have that with EXOIE because it's penetrating fully transdermal and it goes through the entire dermal architecture. Once you get through the epidermis into the dermal layers, the cells pick it up and then they pass it to one another through transcellular communication, and then it's absorbed through the entire dermal architecture. Additionally, pre-treating does another thing, which I'm sure you've noticed, is it will dilate the pores as well, because it's designed to do that, but the vehicles will actually help your numbing cream absorb deeper as well.
It does that.
Yeah, so you get a better numbing effect down into the deeper dermis, so then your treatment is a much more pleasant experience.
So much more comfortable. I mean, we were getting pain, redness, swelling, etc., which we do expect with RF needling and fractionated laser treatments. But having used that now for coming up to 2 years, we just don't get that anymore. The redness is maybe 12 hours long, but I would say 100% less than what we used to get before. So that makes total sense, the transdermal delivery. The other thing that it also does, out of feedback from my patients, is they don't get itchy as they're going through the healing phase.
The itchiness comes from what histamine release, right?
That's
so
right.
if we reduce, and acute inflammation really causes mast cells to release a bunch of histamine. Well, if we mitigate those factors, right, the pro-inflammatory factors that release, again, the redness, the itchiness, you're gonna decrease that response. And then continued inflammation in the body will actually continue that histamine release. So that can last for a couple days sometimes, the itchiness. Well, you don't have that problem when you utilize EXOIE because you've mitigated that response, you've reduced it by a factor of 61%, actually. We've proven that clinically, in labs, in vitro, with studying it on human cells. And so, remarkably, that helps the healing process, one, to just be more tolerable, and two, to go so much faster.
So that's brilliant. We have covered the pre-treatment, the in-clinic phase, and then we want to continue with the 7 days of repair home care. And what essentially you said we're trying to do is to continue that proliferative phase.
Yeah, exactly.
Yes.
Yeah.
So can you share with us some of the key ingredients in repair?
Absolutely. So repair, it's a lot of similarities and differences as well as the system. So ideally what you've done is we detoxed, obviously, we stimulated autophagy, hydration of the skin, and then day of treatment, utilized EXOIE and mitigated a lot of inflammation and kicked off the cascade for collagen, elastin, hyaluronic acid production. And now what we want to do is reinforce that signaling. So there's a lot of the same ingredients in EXOIE as there are in repair. Now EXOIE has more, but essentially what you're doing is you're continuing that anti-inflammation signaling. A big proponent of the stem cells that are in this, everybody wants to know what's in it, right? So a big proponent of what's in this is the piper nigrum, which is black pepper, and then ashwagandha root as well.
People love that.
But ashwagandha has a lot of applications, within kind of the functional med space.
It does.
And then there's also a eustallago ferment as well. 3 real key ingredients, based off Ayurvedic medicine principles that continue that anti-inflammation and really stimulate that proliferative phase in the wound healing response.
There are multiple fantastic ingredients from different plants within all of these formulations. So why multiple and not just one? Because this is what a lot of us want to know.
What's great about utilizing multiple plants is the signaling that you get. So utilizing plant stem cells, yes, plants can control human cell signaling. We've seen that, through, there's dozens of papers and, Ayurvedic medicine principles have taught us this for years, that plants can control human cell signaling. But a plant stem cell is not as dynamic as a human stem cell. So I can't take a single plant stem cell and put it into your body and it function. It needs signaling from other factors to be able to do that. So a single plant stem cell is not going to be as dynamic and to give all the factors that human stem cells are going to give. So in learning the language of the cells, when we developed the product, knowing that there was thousands of growth factors, we had to select different plant stem cells based off of their principles to mimic that signaling, and we couldn't do it with a single plant. We couldn't do it with 2 plants. Most of the factors have 3 to 4 different plant stem cells involved in their development, because look, the body is very dynamic. We're very aware of that. And plant cells are very dynamic as well. And our bodies are formatted like to absorb nutrients from plants. I mean, we eat plants, correct?
Every day.
We absorb those nutrients. And the universal language amongst all living things is DNA.
Yes.
So, and plant DNA is not really any different from our DNA. It's just a matter of what signaling they are carrying, and different plant stem cells are going to carry different signal. It's kind of a complex answer to a really simple thing. Human stem cells are more dynamic. That's why we use multiple plant stem cells to get the exact product, because we couldn't do it with a single plant stem cell.
What many of our colleagues want to know is, what is the difference between an exosome containing system, such as this, compared to a product which has 23 billion exosomes or 123 billion? How many billion? How many billion ingredients?
Sure.
How many billion exosomes? How many billion composition factors? Like, how would you describe this?
So, the total number we've tested, but it really doesn't matter the number of exosomes. The complex itself is about 34 billion exosomes. It doesn't matter how many billion exosomes are, or how many billion envelopes like we talked about. If the letter's in Chinese, but I speak English, I'm not going to be able to read a Chinese letter. So it matters what goes inside those exosomes is what really, really matters. So 300 billion, 400 billion, that doesn't matter. It's a matter in what the signal or the language that you give it. And then the growth factors really matter.
Yes.
There's a lot of different products out there that utilize different extracts. Depending on how they process them, they may lyophilize them or freeze dry them.
Correct.
Which changes protein shapes, which changes their function. And even when you reconstitute, you don't get that same protein shape, i.e. function, back. It's like, dehydrated milk.
Yes.
If you've ever had it, I've had it a lot, in my time in the military, and when we reconstitute it, it was kind of like white water, right? It wasn't the same because those proteins and fats don't all come back.
That's right.
So you reduce functionality. So that's important in the preparation. And then having all the growth factors in place as well. Like a lot of different products too will put, 20, 25, peptide synthetic factors back in, of the most important ones that they feel. But look, there is thousands of growth factors in detox, EXOIE, and repair. And I can't even name them all. But ideally, it's to mimic exactly what the body needs in those thousands of biochemistry processes. So in preparation, how it's made is we have a patented medium. It's a water-based medium that we grow the cells in, and we put them through the processes of inflammation and the proliferative phases of wound healing. And then we collect the entire cellular soup. And because it is plant-based, we don't have to heat the cells, essentially pasteurize or kill off any pathogen risk, right? Because you're not going to get, kingdom transfer of any pathogen. So we don't have to denature anything or essentially inactivate any of the signaling or the proteins.
So you're getting the whole thing in entirety.
Yeah. So the entire cellular soup, and then in that, and the way we prepare it is a sterile format. So we have a very clean product at the end that's all bioactive. And because it's from plants and they don't breathe oxygen the same way human cells do, right? We breathe oxygen and plants breathe, CO2, and humans run on glucose and plants run on, sunlight and chlorophyll.
That's right.
So because of the way that plant cells are formulated and their extracts are slightly differently formulated, they're shelf stable. So these products are shelf stable for a few years, and you don't have to freeze them, right? And so, which is going to decrease their activity, and so you can pull them right off the shelf and utilize them.
It's beautiful. It's so clear, and I understand all of this. And these are key points that are going to be so useful to our colleagues to differentiate many of the other formulations that could be out there beyond exosome, is what I call this.
Yes.
EXOIE is so beyond exosome. We touched on a point earlier where you said it loses potency, it loses its activity when you reconstitute it, for example. What percentage is lost?
So the literature shows when you when you freeze dry or lyophilize something, you can see 40 to 60% of the functionality of those proteins lost on reconstitution.
Wow. That's a lot.
So they'll still work, or some of them won't reconstitute all the way, so it's a pretty big reduction to cut in half, the potency of the peptides or the growth factors in a product. And additionally, the complex is important to have those multiple hits in the system as well, right? You want to continue stimulation, not a one-hit wonder.
No.
I liken it to the gym. I could go to the gym once a month for 8 hours and I'd get sore and I'd get a little bit of, growth, or I could go every day for 40 minutes.
That's better.
Exactly.
Yes.
So continual stimulation.
Dr. Rob, could you give us an explanation and the key differences between EXOIE, which is fully plant-derived, versus a human-based system?
So there are human versions of, exosomes out there, but the comparison really comes down to what's in the final package, like we talked about. With human stem cells and their extracts, 99% of the time you have to irradiate the stem cell base, or you have to put it through a pasteurization process. When you do that, you denature most of the growth factors, you denature most of the proteins, and really you're kind of left with some exosomes and some microRNA. And so you have signaling. And so what they're usually left with in human products is building back synthetic peptides and growth factors into the product. So you get a limited number of signaling. Again, when you put a synthetic product into the body, what typically happens is that negative feedback we talked about. Again, synthetic hyaluronic acids or different synthetic growth factors will decrease the natural production as well. Does it help you in a single treatment? Sure. You get some, I'm never going to say a product doesn't work, but are we helping our skin in the long term? Ideally not.
So Dr. Rob, we've gone through the 15-day version, and can you just tell us how that transitions into the home care series now?
Ideally, you've boosted your skin in the revitalizing complex. You've kicked off that signaling, maybe you've done a treatment with it, or maybe you've utilized it as its own, stem cell technology facial. Then ideally what you want to do is, you've got your skin boosted, is you want to continue that signaling, continue that hydration, and continue that anti-inflammation, because really inflammation is what causes aging, right? And so by overwhelming demand, we had a ton of requests, really is where it came from, especially in people with inflammatory skin conditions, that they saw clearance very quickly, even just starting utilizing detox, and whether it was redness or some type of ectopic dermatitis, all of a sudden their skin was clear and it was hydrated, and then they were begging for the repair as well, because they loved almost the luxurious feeling their skin had after utilizing it as well.
Yes.
And so we moved to utilize, the home use as well. Essentially what you do is after your complex and you do your 15 days and you get done with your 7 days of repair, then you would start detox in the morning. And again, that's going to provide your skin that hydration and stimulate that autophagy that's normally happening when you wake up anyways. Your body wants to hydrate itself because we've dehydrated ourselves all night, as we spoke about. And then you have autophagy all day long because you're exposing your skin to toxins. And then at night, you'll utilize the repair. It's going to give you that anti-inflammatory effect. And what happens when we go to bed at night? You speak about this a lot.
We regenerate.
We regenerate. So we're going to stimulate the regenerative signaling in our skin, so stimulate collagen, elastin, hyaluronic acids. And
I love the fact that we can go to bed and we are literally giving our skin something that's going to upregulate the body zone. So this is when I talk about autologous therapies, and this is in fact an autologous therapy. We're not supplementing the body or skin with anything. We're literally telling the body to wake up.
Ideally, we're trying to mimic that autologous signaling, and we've accomplished that with biomimetic or bioavailable plant factors.
So how long generally would that system last for, Dr. Rob?
Typically that system lasts you about a month if you're utilizing it once daily, morning and night, and that essentially replaces your skincare. So whether you're utilizing different creams or whatever anti-aging serums you're utilizing prior to, we've seen this replace it wonderfully, and just have rave reviews across the board about the plant-based exosome skincare.
Well, what I've seen amongst our patients, because they've been on it now for close to 1.5 to 2 years, is they look better over time. And I think it's that continuous, you talked about sustained build of collagen, elastin, upregulation of HA. They certainly look more juicy, more dewy, as in their skin. And the barrier of the skin is so much more refined and more restored. It's more robust and resilient.
For sure. What happens when we age? As we age, we get thinner, more brittle,
decline.
right, immune decline skin, essentially. So if we can help our process to, again, push out the toxins, push out all the harmful things that our skin absorbs, get it super hydrated, and then regenerate that collagen, elastin, barriers, essentially, or the elasticity of our skin, and the collagen gives you the volume, you are going to look younger. You're going to get that tone back, and that's the goal. And we're seeing it happen, which is really remarkable.
It is. We talk about regenerative medicine, and you talk about anti-aging medicine, and I also talk about longevity medicine. Mm-hmm. We are hopefully destined to live a very long time. And if we keep suppressing things just with supplements, we could be doing ourselves a lot of, I don't want to say damage, but injustice for the long term.
Sure.
So what I love about this system, that it really is preparing our 40s or 50-year-old selves to be the best versions and healthiest versions for our lifespan.
Yeah, it's about increasing the health of your skin organ as you age versus letting it slowly decline. It's about trying to reverse some of that, which modern technology and anti-aging medicine is allowing us to do.
Correct.
And it's not about just replacing, it's about letting the body do it naturally.
What I want to know now is a little bit about DERIVE, because over in 2020, 2021, post-lockdown, many of our female patients, because that's most of my patient population, were struggling with thinning hair, brittle hair, hair loss, shedding, all of the above. And they were young. They were anywhere from 26 even to about 36. And I would naturally expect a presentation like that from someone in their 50s and beyond.
Absolutely.
Your typical postmenopausal, stressed out corporate, etc., or maybe even a genetic predisposition, and the men. But our patients were presenting young, and we needed to give them something fast, something easy, accessible, something that we know had already come from a legacy product, ideally. Can you share with us how you created this? What are the key differences? What is in DERIVE?
Hair growth and the scalp is going to be different than obviously the skin on your face, so you need a different formulation. And so there's really kind of 5 things with hair restoration. I really call them the 5 pillars of hair restoration that you have to really focus on. One is going to be anti-inflammation. The next one is going to be angiogenesis, so providing blood flow to the follicle itself. 3 I call structural change. So you got to stimulate structurally different in the hair than what you do for the skin. So the hair is very focused on collagen, but also cytokeratin. All the data is shown if you can get cytokeratin production, you'll grow hair. The 4th thing is signaling. So you got to signal different pathways. One significant pathway is called the beta-carotene WNT pathway, but then there's stem cell signaling that needs to take place as well, which I'll get into. And then the 5th is the scalp health, because the follicle is one thing that grows the hair shaft, but then the scalp dermis is slightly different as well. So let's address anti-inflammation. With EXOIE technology, we knew that we could control inflammation very well to cellular level. So those technologies are within DERIVE. And then angiogenesis. So hair loss, there's kind of 2 things in hair loss. All forms of alopecia are going to have an inflammatory component to it, which usually attacks the vasculature. And so as we lose hair, you see the hair go from really nice thick shafts to get thinner and thinner and thinner, and then it loses color and gets wispy and then brittle, and then it's gone. You can essentially equate that to the loss of the blood flow to the follicle. So you have to stimulate angiogenesis. What we've seen clinically is this stimulate angiogenesis rapidly, and that's through the EXOIE technology as well. In vitro, we're able to grow a capillary bed within 3 days, which is very remarkable. Yeah. And then structural. Okay, so we need to stimulate collagen production, which we knew EXOIE could, so we took some of those same components, but cytokeratin is a very different component. And so what we utilized was we studied human stem cells and went down the Ayurvedic medicine list, right, of seeing what could actually stimulate beta-carotene and cytokeratin production. And DERIVE is different that it has stem cells from curry leaf. Some of the same plants in EXOIE, but curry leaf is the really distinguishing factor in EXOIE, and that carries a lot of nutrient delivery. It's like vitamins A, vitamin B2, a lot of iron as well, and which is a real component of hair loss, actually. Females are going to be predominantly magnesium deficient in hair loss, and males are going to be predominantly iron deficient. And then both populations are usually going to be a folate deficient, which is a B vitamin as well. Yes. So supplementation is important as well. And then we have to think about signaling. So there's really 2 signaling we have to worry about. First one is getting the anagen phase of hair growth. That's where we grow, right? Our telogen phase is where we pause and then we go into a shedding phase afterwards, right? And so, we see what we call telogen and fulvium post-COVID. You get that temporal wasting really bad. You see that post-menopause as well, or in postpartum, you see this a lot. And like hair loss in guys, it's kind of just our ticket. Like 70% of males are gonna see thinning hair, 50% are to deal with balding. It's been more socially accepted. Now, I think we are getting more and more generations where men don't want to lose their hair, and they don't have to. And we're seeing it younger and younger populations, but now women, as you mentioned, are actually on the biggest rise of hair loss, within globally. And it's something that we have a safe, natural option that we can help them attack with. And look, female hair loss is almost loss of your identity, I would argue as well. It can be much more detrimental. And so we're seeing more and more females in the market space, within your practice, as you said, just getting and seeking treatment at younger and younger ages for hair restoration as well. Getting into signaling though, we have to signal that anagen phase of hair growth. And so what's great about this is carrying cellular signaling to actually wake up those follicles. There's kind of a highway of stem cells in our follicle. There's down in the root, there's the bulb of the follicle, and then there's the bulge where a bunch of the stem cells live. And what people don't realize is you gotta move them down to get the signaling going, and this will actually stimulate that anagen phase or that stem cell migration down the highway to get that signaling going. And part of things that block that signaling is inflammation. So we got to knock down inflammation to open up the highway, right? Yes. And then lastly, you have to think about scalp health in general. So obviously there's things that you want to look at, check hormone levels and things like that. Obviously our scalp is more oily than our face is, right? And so we have to support, the natural oils and the pH of what the scalp is going to be. And so this is pH balanced specifically to be transdermally absorbed right through the scalp as well.
So you don't need to needle it, you don't need to inject it. It's exactly like the other EXOIEs, it is transdermal.
Yeah, ideally you wouldn't want to inject this. It's actually pH balanced and your skin's slightly acidic, right? And so it's going to be a slightly acidic product that as it absorbs transdermally, it loses that acidity like any natural product would. And yeah, you don't have to needle, you don't have to create big holes. It's going to get in there and absorb really well. We have found that ultrasound technology has actually boosted its absorption. It's actually really what it's doing, it's boosting its concentration of it at a deeper level. It's not really boosting the absorption, it will absorb transdermally, but if I can take all the product and then put it right down where kind of the root of the follicle is, you can target it and get more signaling. It's like having a conversation in an open field and we could yell at each other, right? And it would happen, it would take longer and probably not be translated as well, or we could have a conversation like you and I are right now. Obviously, we're going to communicate better face-to-face. It's exactly what utilizing like an ultrasound technology does, like within the Aquafirm, where you utilize that ultrasound, concentrate it, but also, ultimately, ultrasound is stimulatory to the follicle as well without causing any damage the way needling can.
And that's what we want to create. We want to create less inflammation. Exactly. And this is what I say to patients, because we have the Aquafirm treatment at our clinic, and the patients love receiving the treatment.
Absolutely.
It feels comfortable, it feels nice being treated by one of our therapists, one of our team, and they're having best-in-class ingredients, scientifically backed. But what I love, again, is the fact that you've discussed about the root cause of thinning hair. It's all about the root cause of it. Inflammation, angiogenesis, we talked about aging being a lack of perfusion, we talk about mitochondrial dysfunction throughout all of the cells, and then you talk about the proliferation and the signaling. So we're not just coating the hair with anything, we're really getting to the root of the problem with DERIVE.
Absolutely, it comes down to the language of the cells. We studied the stem cells that surround the follicle, and we practiced our different formulations to, again, get that exact signaling. And that's what's really important, is giving the cells everything that they're asking for and not leaving anything out.
So Dr. Rob, we've had a lot of success and a lot of understanding about DERIVE for scalp health and hair growth. And what I'd love to understand now is, how did you evolve then into the shampoo and conditioner by DERIVE?
That's a good question. Yeah, we did start with the in-office treatments, obviously with DERIVE, pairing it with ultrasound, then the take-home serum. Then it was about people were asking for more continuation, right? They wanted more. So we developed the world's first cellular shampoo.
What do you mean by that? Cellular shampoo?
So it's continuing the signaling of DERIVE and supporting it at a cellular level. So there's similar technologies from DERIVE built into the shampoo as well. Now, you can't just utilize the shampoo itself, you need the serum with it, but it's again compounding and continuing that signaling. And the shampoo is also designed to not be stripping of the hair, of the natural oils and the natural production that the hair has. A lot of shampoos are designed where they're going to strip your hair, and then you almost like have to use a very thick conditioner because your hair feels dry and almost brittle sometimes after shampoo. And actually this shampoo has like no sulfates in it as well, so it's not going to foam up a bunch like a traditional shampoo. It's, you know, we're used to these really, really foamy shampoos, but what we don't realize is we're introducing toxins into our scalp with sulfates and phthalates, and so it's free of those as well. It helps continue that cellular signaling, and then we also have a leave-in conditioner. And ideally with the leave-in conditioner, you just kind of spray it into your hands and work it through your wet hair and massage it in. And what it's going to do is, again, provide protection for the hair as well. Even when you go to straight iron or curling iron your hair or blow dry it, that's caused damage to your hair. Well, this conditioner actually helps protect from that, from any kind of thermal and UV damage.
So could I put that on, leave it on, and blow dry my hair
Absolutely.
after that?
And then go into styling it.
See, I've learned something new today, because I've been sporting a wet look for a while, and to be honest with you, I've noticed so much change even by using it back to back with this. Could I just ask, if someone had extensions where they're removing their extensions, that also causes traction alopecia, doesn't it?
We've actually seen really good response with the DERIVE system and the home supportive care as well, the shampoo and conditioner in those traction alopecia patients. It doesn't matter necessarily the form of alopecia, whether it's traction alopecia or an inflammatory alopecia like areata, or even just normal male and female pattern baldness. Every form of alopecia, as long as those follicles are not dead, we have seen response with DERIVE in.
Thank you so much for sharing all of that with us, because we've gone from plant versus human. We've gone from exosome to beyond exosomes. We've then also gone from not just a few million or billion, but it's a complete composition from the stem cell in a plant-based version. And then we've also gone from skin to face to scalp and beyond. So what I really want to know, because I have it all, and most of the UK is now so much more knowledge in what the product is. What's coming next?
So we do have constant developments within the line, but we are excited to announce that we are launching an anti-aging skincare line. So the system will be available within the US and surrounding UK and Europe, and we're going to be balancing the first really exosome-based anti-aging skincare line.
Wonderful. Do you have any timeline for this? Are we expecting this in 2025?
We are expecting it to come fall of 2025.
What I think is fascinating about your group, your team, AMP, is the fact that you are continuously innovating and evolving in your product portfolio. And having watched the system evolve from 2 years ago, where this first came into the UK, which is a 15-day profile, and evolving into the home care, starting with the serum for DERIVE and then evolving into the shampoos, and now having a complete portfolio of products in just under 3 years. That's fast. AMP
is really dedicated to innovation. It's really fun to be a part of, having an amazing team of scientists behind us that are constantly researching, and between, the team, there's probably 100 years worth of cell research and publications. And so the lab works nonstop, honestly, to just bring new formulations that are constantly there. And it's amazing with to be able to keep up with the pace of technology. Technology has evolved so much, and really, if you think about it from a health level and a body and cell level, I feel like we've kind of lagged for many years. And now I feel like technology and what we can do with cells and what we can do with regeneration is meeting it. And that's really our dedication at AMP, is to bring innovative products to the market space that do two things, really. Have a good clinical outcome and a great patient experience. And that's what's really important.
There are a lot of other companies out there that promote exosomal products, or 40 billion, 23 billion, 137 billion, single plant-based, etc. How does a layperson, how does a consumer, how does a journalist, how does a prospective patient, how does a buyer decide why this versus the other? Any advice to anyone out there?
Well, it really comes down to understanding, I think, what you're getting in the product. The whole EXOIE line, as we like to call it, it's a complete package. It's a full package of biomimetic signaling with thousands of growth factors without any synthetic products in. So ideally what we want to do is mimic the body's really natural responses, give it all the building blocks that it needs, help it with the signaling, and let the body regenerate itself. And you don't really get that in any other product out there. This is, a patented product that really nothing can be like it. And that's what I love about the system is it's really about the complex, complete package. The lab has done an incredible job of understanding what we're looking for. It's understanding that we're here to heal from the inside out, not the outside in. And that's what this system helps you do.
Well, thank you so much for sharing this with all of our audience today. It's been an absolute pleasure hosting your line at the clinic for 2 years, and especially here in the UK for 2 years as well. We look forward to introducing balance to the UK and beyond, and I want to wish you all the very best.
Thank you. Looking forward to it.
So Dr. Rob, we've seen the introduction of Solenis PRP here in the UK, and it's been so successful. Can you tell us why the Solenis PRP system is probably the #1 worldwide system?
Absolutely.
So efficient for PRP?
Solenis PRP is the most studied PRP worldwide. There's been over 1 million procedures performed with it as well. It's really the only PRP system in the world that has multiple peer-reviewed published articles behind it. There's a lot of PRP systems that will do a white paper or something like that, but this has been utilized by multiple training institutions, really across the globe. Because look, not all PRPs are created equal. There's a lot of things that it comes down to. It's about eliminating red cells. It eliminates 99.9% of red cells. And then it's about eliminating the granulocytes. This eliminates about 93% of the granulocytes. And then the last thing is a physiologic pH product. There's a lot of things with PRP systems that you hear about, especially with hair restoration. If you're injecting it, it burns. Well, why is that?
Correct, yes.
Their anticoagulants aren't pH balanced. So the Solenis PRP system actually has a physiologic patented pH as well. And so you end up with a product that's balanced, essentially, it's an autologous product, but you end up with a physiologic pH balanced product, so you have no issues with re-injecting it. So you can re-inject it into the scalp or you re-inject it into the skin, and you face no problems whatsoever.
The introduction of the next version of the PRP system, which is autologous dermafiller PRP. Can you tell us about that?
Yeah, so the Solenis dermafiller is essentially taking your own blood and creating a filler product out of it. What you're doing is you pull off the blood and we spin it down, traditionally just like PRP, and you're left with plasma. And within that plasma that's sitting above the gel separator, there's PRP, which is your platelet-rich plasma, but then there's PPP, platelet-poor plasma. What plasma is, it's really just a bunch of plasma proteins that are sitting in there, and then platelets as well. So the albumin is the significant protein in our plasma, and so we'll pull off the top portion, so the platelet-poor plasma, and then we'll heat that. And what that does is it opens up that albumin. It denatures it slightly. It's still active and alive, but it opens it up and creates a gel. So then you heat that up for about 10 minutes, and you cool it for a few minutes, and then you take the remaining platelet-rich plasma and you reconstitute it together. There's a lot of videos out there you can see people reconstituting,
Yes.
and it's kind of fun to do actually.
I love doing it.
So then you're left with a gel product that's biostimulatory. So now you have something that can give you the best of both worlds. You get immediate volumization and long-term biostimulation. Its use in the body is really remarkable. So we have a lot of places where traditional hyaluronic acid fillers don't do well. Let's say under eyes. Like we've learned that injecting an HA filler under the eye doesn't work well, right? It migrates. You get Tyndall effect. It's left with pooling. What's great about utilizing derma is we've seen a lot of effective use, especially in that under eye area, or some of the no-go zones where filler wants to migrate. Well, this is your body's own product. It's going to take, it's going to stick, and then it's going to give you, months up to a year's worth of biostimulation in the protocol, also giving that volumization that you're looking for without it being a synthetic product. That's very key these days. More and more natural-seeking patients out there that don't want to put a synthetic product into their body or have had reactions to synthetic products as well. That's what I really love about this product is it's safe, it's effective, and it's literally your own products.
Made by the body for the body.
Exactly.
That's how I'd explain it to patients. So many interesting points there, because you mentioned autologous. And about 2018, I was using not just 1 cc of HA filler. We were going from 1 to 2, 2 to 4, to 6 to 8, to 12 to 16. And it made me wonder back then, how long can I keep using large volumes of synthetic filler over and over again throughout the lifespan of patients as they're aging?
Right.
You know, into their 60s, their 70s. We've been talking about the biology of patients and using systems like EXOIE to supplement them, to really heal the body, as well as to promote the synthesis of the body's own collagen, elastin, hyaluronic acid, to mimic what the body needs.
Sure.
And so for me to really consider an autologous filler that's going to give the patient exactly that over their lifespan, irregardless of volume, it just made total sense.
Yeah, it kind of goes with that whole purpose of really, I think, where we're going in aesthetics and functional medicine is healing from the inside out. You can take an autologous product and inject it, and then with a single treatment, you're going to get 3 to 4 months of volumization and about 5-6 months of biostimulation. Because before what we had with PRP, it's always been a really strong biostimulator for the skin, but traditionally, regular PRP, you inject it and it's gone within days.
Correct.
It gets mobilized and it's out of there. Well, now you've given it a lattice to live on and kind of feed on with its own albumin sitting there. I call this like long-term, PRP release essentially. And that lattice is giving you really strong volumization as well. Now it's going to be different volumization than what you get in a hyaluronic acid filler because it is different. It's not going to necessarily stand up the same way, but you're still getting a natural volumization. And then the protocol that we've done very successfully in the United States is you want to do 2 treatments really. If you want to get some really good longevity in the volume, if you do 2 treatments within 4 to 6 weeks of each other, you can get 9 to 12 months of volumization and
That's good.
And a good full 12 months of biostimulation as well. Is it a one and done treatment? No, not really, but really nothing in aesthetics is. But it is an incredible natural option with awesome biostimulation, really from literally your own signaling, because it is autologous. Yes, absolutely. And we've seen a lot of practices really adopt and we come to love it because it's not just for the face. Because it's autologous, you can really put it anywhere in the body. We've seen everything from Brazilian style butt lifts to be done with this. We've seen neckline augmentations done with this. Works great in the back of the hands as well. And especially even kind of those no-go zones where we had filler before, putting a natural product in there that really sticks and sits, in those perioral lines, even some nasolabial folds, because it doesn't stand up the same way, so you don't get the heaviness.
The stiffness.
Exactly. Yeah. So, and then it's going to move naturally with your face as well. So it's really become just one of the hottest products in the United States and really expanding globally now.
I'm so excited about this. We have gone beyond aesthetic medicine. We've gone way beyond regenerative medicine now, and we're really looking at longevity medicine and beyond.
Absolutely.
We talk about health span, we talk about joy span, making people happy, safe, and healthy. And this just sits in and segues perfectly with everything that we're doing, not only in the US, but here in the UK as well. We're seeing a real paradigm shift in how we approach patient care, human care. And I think it's so refreshing to know that plant-based systems are really coming into the light again with the exosomes, with the topicals, with the hair care, now into the PRP systems, and now into our facial fillers.
It really speaks to the inside-out healing mentality that we've done from a natural aspect, trying to give patients literally those really 2 key things: a good clinical outcome with a really good patient experience. And that's where aesthetic medicine, I think, it's become functional aesthetic medicine is really where we're at. And we've seen this transition, and I'm really excited about what we have currently and what's coming in the future as well.